Understanding pancreas lesions on CORT scans. Imagine looking inside the body with a powerful camera that takes detailed cross-sectional images. That's what a computed tomography scan, or CORT scan, does for the pancreas. When doctors see abnormal areas on these images, they need to figure out what they are. These abnormal areas are called lesions, and they can be harmless cysts, precancerous changes, or even cancer. Understanding these lesions is key to deciding the right next steps for diagnosis and treatment. Pancreas lesions come in different forms. Some are solid tumors, which are made up of dense tissue. The most common and aggressive type of pancreatic cancer is called pancreatic adenocarcinoma. On a CORT scan, it often appears as a darker or hypodense mass compared to the normal pancreas tissue. Then there are cystic lesions, which are fluid-filled sacs. Some cysts are benign, meaning harmless, like serous cystadenomas, which usually look like small clusters of tiny cysts. Others, like mucinous cystic neoplasms, can be precancerous, so they need careful monitoring. These cysts often don't connect to the pancreatic ducts, unlike some other types. Sometimes, lesions have both solid and cystic parts, which can make diagnosis trickier. To get the clearest picture, doctors use specialized CORT scans called pancreatic protocols. These involve multiple images taken after injecting contrast dye into the bloodstream. The contrast helps highlight differences between normal tissue and abnormal lesions. Patterns of how the lesion takes up contrast can help tell if it's benign or malignant. For example, solid tumors often look darker than the surrounding tissue, and cysts may have septations or nodules that suggest higher risk. The CORT scan also shows changes in the pancreatic ducts. Dilation of the main duct or branch ducts can suggest certain types of cysts or even early signs of cancer. If solid parts or nodules are seen within cysts, that can be a warning sign of potential malignancy. When it comes to pancreatic cancer, CORT scans are vital. They help detect tumors early, see how far the cancer has spread, and determine if surgery is an option. If the tumor involves nearby blood vessels or organs, that can influence treatment plans. However, CORT scans are not perfect for every lesion. Small or subtle abnormalities might need additional imaging, like magnetic resonance imaging or endoscopic ultrasound. Magnetic resonance imaging, especially with special techniques like Mr. cholangiopancreatography, provides a detailed look at the ducts and can better identify whether cysts communicate with the pancreatic duct system. Endoscopic ultrasound allows doctors to get very close to the pancreas and even take a small sample of fluid from cysts for laboratory testing. This helps assess whether a cyst might be cancerous. Many pancreatic cysts are found incidentally when people have scans for other reasons. Most of these cysts are benign or low risk, but because some can develop into cancer over time, doctors often recommend regular follow-up scans. If a cyst grows larger, develops new nodules, or if the ducts become more dilated, these changes can signal a higher risk of cancer. In such cases, further testing or even surgery might be considered. In summary, CORT scans are a crucial tool for identifying and understanding lesions in the pancreas. They help distinguish harmless cysts from potentially dangerous tumors, guide treatment decisions, and monitor changes over time. Recognizing the features of different pancreatic lesions on imaging allows healthcare providers to manage pancreas health effectively and catch problems early. Always remember, if you have concerns about pancreatic health or lesions seen on imaging, consult with a healthcare professional for personalized advice and appropriate follow-up.